Hi, my name is Gemma Chen, and today's presentation, I'm going to explore the hidden costs of menstruation, addressing period poverty worldwide. And before my presentation, I'd like to briefly introduce myself. My name is Gemma Chen, and I live in Seattle, Washington. I'm currently a rising junior at Glacier Peak High School. For over a year, I've been volunteering with nonprofit organization Astro Life, and I also volunteer at Imagine Children's Museum. At school, I serve as a leader in a speech and debate club and as a captain of our dance team. I also love participating in art and knowledgeable. I've always been deeply passionate about medicine. My dream is to become a surgeon with a focus on cardiovascular disease, inspired by my own personal experiences. But beyond clinical practice, I care deeply about the broader challenges people face in accessing care. That's why I'm drawn to global health. It's a field that doesn't just deal with illness, but with social, political, and economic systems that affects people's ability to live healthy lives. And today I want to talk about menstruation, a topic often treated like taboo, almost as if we're the thing that must not be named. Yet in reality, there's more than 2 billion people around the world menstruate every month. According to Wikipedia, menstruation is a regular discharge of blood and mucosal tissue from inner lining of uterus through the vagina. It is completely a natural biological process, but in many parts of the world, it's seen as dirty, shameful, or even as a disease. This stigma has real consequences. According to World Bank, at least 500 million women and girls lack access to menstrual products, adequate sanitation facilities, and education about their periods. This is known as period poverty and is a global health issue. It doesn't just occur in developing countries, it exists everywhere, affecting education, employment, and health outcomes. My speech today will explore period poverty from 4 key angles. First, why is a problem? Second, health risks it causes. And third, what menstrual stigma makes it worse. And finally, what we can do to reduce or even solve it. Let's do a quick calculation with me first. Most women menstruate for about 38 years, and each period cycle lasts from 3 days to 7 days, roughly every month. So days of menstruation through a woman's lifetime is about 2,280 to 2,540. That adds up to around 7 years of bleeding in total. Over a lifetime, one person might use up to 16,800 pads or tampons. According to American Medical Association, that can cost anywhere from $1,800 to $18,000. For low-income families, this monthly expense can be a serious financial burden. In many regions, women still rely on unsafe materials like toilet paper, cloths, or unclean reusable pads during their periods. This greatly increases the risk of bacterial infections and urinary tract issues. A major reason behind this health risk is that lack of menstrual education. Despite being a normal biological process, menstruation is still surrounded by stigma, leaving many girls with no support or information when problems arise. This silence can lead to serious consequences in women's reproductive health. For example, endometriosis, a disease where tissue similar to uterine lining grows outside the uterus. Also, what many people also don't know is that menstrual blood is a valuable resource. It holds important medical insights into hormone imbalances, endometriosis, and even cervical cancer. It also contains stem cells with potential in treating liver failure, spinal injuries, and diabetes. Most importantly for women, it's an easily accessible and renewable resource, yet it is still widely overlooked. As one of millions of women around the world, I believe period poverty is a global issue that has been overlooked for way too long. It's time we're starting paying real attention to something that affects half of the world's population. The first step to tackling period poverty is changing how people think and talk about periods. For so long, menstruation has been treated like something gross, embarrassing, or just a woman's problem to quietly deal with. One clear example is how periods has been showing as. If you look at an image on the left from a commercial at late 1900s, you will see they used blue liquid instead of real blood, because the real thing was seen as too disgusting for viewers. Thankfully, that's starting to change. Some brands now show periods more realistically and even celebrate them. And this is not just a reform of menstrual advertising, but also a liberation of society from menstrual issues. A crucial step to making menstrual products more affordable and accessible is addressing how they are taxed and priced. In many countries, menstrual products are still labeled as non-essential and subject to high sales taxes, a problem known as tampon tax. This unfair classification drives up the prices and creates barriers for those already struggling with period poverty. Policymakers should eliminate these taxes and recognize menstrual products as basic healthcare necessities. In fact, the American Medical Association has called for all menstrual products to be tax exempt, urging the IRS to formally classify them as healthcare essentials. Beyond policy, many organizations are stepping up to support menstrual equality. Nonprofits like Aliens of Period Supplies, Days of Girls, the PET Project, and Parent.org are helping women support women. This year, I also applied to a local chapter in my community to provide few menstrual products to schools and the public. Promoting menstrual education will be a big part of our work, and I look forward to collaborating with others who share the same mission. When I got my first period, I was overwhelmed and scared. I've seen my white pants at school. I've hidden pads in my sleeve. Because I menstruate, I understand the discomfort, the shame, and the judgment that can come with something so natural. These personal experiences are exactly why I care so deeply about this global health issue. So, what can we do to help the girls and women who don't even have the access to menstrual products? First, as I just mentioned, donating to organizations that fight period poverty, whether through financial support or product donations, is a direct way to make a difference. Second, we can challenge the shame that surrounds menstruation. Speaking up about periods, whether online, in public, or just with friends, is how we begin to break the silence. And even small changes help. Support free period project policies in schools and in public places, and treating menstruation as a normal, vital process it is. Period poverty is more than just lack of pads or tampons. It's a barrier to economic, education, dignity, and health. Nobody should have to miss school, feel ashamed, or risk their well-being just because they menstruate. These are my references to support my research. And here I really want to thank the GHLC program at Johns Hopkins University to give me this opportunity to speak up about this global health issue and share my opinions. And also thank you so much for listening.